Sean. I will be your nurse today, and we will be doing a heart and neck vessel assessment. Before we begin, I'm going to provide you with some privacy. Alright, then I'm going to wash my hands and put on gloves. If you could verify your name and date of birth for me.
Mackenzie Richards, 04/19/1999.
Thank you. To begin, we're going to start with the inspection and palpation of your carotid artery. Alright, you can just look up straight. Alright. Inspection. I do not see any signs of edema, no masses or lesions. Nothing looks swollen. Color is congruent to the rest of the body. Everything looks good. Next, I will be palpating your carotid artery. I'll start on your right and then move to your left. Alright. Upon palpation, I didn't feel any masses. There's no signs of edema. So next, I'll be auscultating to your carotid artery. Upon auscultation, everything sounds normal. I did not note any irregular pulse. Your rate and rhythm was equal. Your pulse was about a 2+, which is normal. So next, I will be moving to the inspection of your jugular vein. Normally, we do internal and external, but because of COVID precautions, we will only be examining the external portion of your vein. If you could lay down for me, please. Alright, and then turn your neck to your left. Alright, upon inspection, the vein is not bulging. There are no other veins visible, which is good. Next, I'm going to lean up the bed to about a 30 or 45-degree angle. When the bed is raised at this angle, your vein should flatten and disappear, which would be the normal reaction for that vein. So that's how we'll be raising the bed. At the 45-degree angle, the vein does indeed disappear and flatten. There are no pulsations. There is still no pulsations visible. So everything looks good. I don't know any abnormalities. I'm just going to put the head of the bed back down. You can sit up for me, please. And then after I put the bed down. Now if you could sit back up for me, please. Alright, next I will sanitize my hands, and then I will be moving to the inspection and palpation of your precordium and your apical pulse. Alright, upon inspection, the chest looks symmetrical. I do not see any pulsations at the site of the apical pulse or the precordium. Alright, everything looks normal, no masses, lesions, edema. Alright, so next I'll be palpating your precordium and your apical pulse. I'll be feeling for any trill, irregular bead, any masses. So next I'm going to begin with your precordium. I'll use the palm of my hand. Alright, upon palpation of that, I did not notice any thrills. Your pulse was a 2 plus, which is a normal finding. I did not feel any masses. So next I'm going to palpate your apical pulse. I'll also be looking for any thrills, feeling for the rate and the rhythm. So undo. Alright, upon palpation of that, I felt the pulse rate and rhythm was, it was a good rate, and the rhythm was not irregular, didn't feel any masses, there's no signs of edema, and I didn't feel any thrill there either. So next, I will be auscultating your chest. I'm going to start with your first 5 landmarks. Alright, so now I'm going to begin with the aortic. Alright, now I'm going to move to your pulmonic. Now I'm going to move down to your Erb's point. Alright, then your tricuspid. And then lastly, your mitral. Alright, upon auscultation, I could hear your heartbeat at all 5 landmarks. The rate and rhythm was equal between each. I didn't note any abnormalities or irregular pulse, and I did not hear any bruits. So next, I'll be auscultating your S1 and S2. Your S1 is your apex, which would be at the bottom of the heart, and your S2 is your base, which will be at the top. I'm going to begin with my diaphragm, and then I will be also listening to them with my bell for any extra heart sounds, murmurs, or bruits. So I'm going to start with your S2 at the base. Alright, I'm going to move to your apex. Alright, with the diaphragm of my bell, everything sounded good. Rate and rhythm were equal and regular between each, and I didn't note anything abnormal. So next I'll be listening to the same landmarks with my bell, and I'll be listening for any extra heart sounds, bruits, or murmurs. Alright, moving back down to your apex. Alright, I did not note any bruits or murmurs at those 2 landmarks. Lastly, I will also be listening in the apical pulse area for those same murmurs or bruits. Alright, I'll be also listening at the Erb's point area. Alright. I did not note any extra heart sounds, bruits, or murmurs. I did not note an irregular pulse anywhere. Everything sounded good. and I did not note any abnormal findings.